Hello, Dr. Brandon.
Hello, Dr. Morgentaler.
Great to see you for another podcast of The Sex Doctors. So listen, there has been some news in the world of testosterone, and I thought it would be good for us to talk about it.
I'm aware of it. The FDA made some changes, and that is big news as far as I'm concerned.
Yeah, it's not often that the FDA changes what they've written to take away a risk.
Right.
Or at least make something seem less risky. They're usually in the habit of adding risks.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
They are. They are protectors of the public, and they take that role very seriously, sometimes too seriously, one might say.
Yeah. So listen, so let me get into it. So in this particular case, what we're talking about is that several of the testosterone products that have been out on the market have had what's called a black box warning about, really it was about blood pressure, but the FDA extrapolated it to suggest that those products could cause more heart attacks, strokes, and death.
Mm-hmm. And what products? Can you be more specific?
Yep. So it first appeared, this black box warning, in 2018 with an injectable testosterone called Xiosted.
Mm-hmm.
And then when the three new oral products, the pills, came out for testosterone between 2019 and 2022, all three of them had this warning added to them.
Mm-hmm.
And what a black box warning is, it's kind of the most serious risk that the FDA can put on a label.
It sounds scary.
Yeah. And a label is what, anytime you open up anytime you get any prescription medicine, they include this little pamphlet or folded piece of paper that lists all the kinds of things that can go wrong and how to use it and all these various risks. And the black box appears at the very top of it. It's the first thing you see. Mm-hmm. And it literally is, whatever that writing is, circled by, well, not circled, squared by a black box, like to make it stand out. So on February 28th, after one of the testosterone companies that had this black box warning, Marius Pharmaceuticals, that makes one of the oral testosterones, Kysotrex, was in negotiations with the FDA. And what they did is they argued that since there was this big trial called Traverse that looked at cardiovascular risks that came out in 2023 and showed no increased heart attack, stroke, or death.
As in zero?
No increase with testosterone compared to placebo. Therefore, this alleged risk in the black box that this slight increase, very slight increase in blood pressure might lead to increased heart attack, stroke, and deaths couldn't be true. And that in light of this new scientific information, they argued that the FDA should change its labeling. And in fact, the FDA agreed to do that.
Well, that's exciting, and I have to believe not just exciting for everyone who uses testosterone or physicians who prescribe it, but you in particular, because you've been advocating for the safety of testosterone,
right,
like your entire career, decades and decades.
Yeah. Thank you for saying that. It's true. Now, much of my work early on was around prostate cancer. But, I was an lead author together with the Androgen Society and their position statement that looked at the data from that Traverse trial that we just talked about and looked at all the literature that came before about cardiovascular risk. And so we published last year a position paper that looked at all the data about whether or not increased testosterone with testosterone products increased the risks of heart attack, stroke, and death. Mm-hmm. And the evidence is overwhelming that it does not. As a matter of fact, there is some suggestive data that it may even be beneficial for the heart to be treated with testosterone, and that low testosterone itself, untreated, may be a risk for a variety of cardiovascular issues.
Isn't that something? Do you want to speak to that at all? About the fact that testosterone could be protective?
Sure. So, for example, there are at least 4 randomized control trials I know where they've given testosterone versus placebo in men, and in one study also in women who had heart failure, congestive heart
I
failure.
go like this just because.
Right? There's not much work around. There's much less work around testosterone in women, but there is.
Yeah.
But this one included men and women who had heart failure, and they got testosterone or they got a placebo. And they look, people who are with congestive heart failure are short of breath. They can't work they can't do as much work or physical activity. And there are ways to measure how their improvement, how much work they can do, how far they can walk, things like that.
Mm-hmm.
And it showed benefits compared to placebo.
How about that?
We know that men who have lower testosterone levels are at higher risk of getting coronary artery disease. It's correlated with the severity of the coronary artery disease.
Wow.
And we have a couple of observational studies done much longer than any randomized control trial can do, because that's a lot of resources. Mm-hmm. Traverse was amazing because it followed these people for 33 months, almost 3 years on average. But some of these observational studies go for 6 years, 10 years, and longer. And we have 2 really provocative trials, studies, where they looked, in one case in the VA population, another in diabetics, about people who had low levels of testosterone, some of whom were treated with testosterone and others were untreated. Mm-hmm. And the mortality rate, the death rate, for people who received testosterone in both of those studies was half as much as the untreated people.
Half as much.
Right. So, like I say, we have suggestive data that the whole testosterone and cardiovascular issue is upside down. Yeah. It's been described.
Yeah.
But I want to come back to this issue here around this blood pressure thing, because there's another thing that's important to mention. So, the FDA and stories that appeared in Medscape, which is often how doctors hear about medical stories, the way most people do. It's either like in the news, mm-hmm. But a lot of doctors there's a platform called Medscape that kind of summarizes most recent data. Mm-hmm. And I think I don't know for sure, but I think it's the largest platform that goes out to physicians and those interested in healthcare. And it described this black box warning as really about cardiovascular issues. And of course, technically, blood pressure is a cardiovascular issue. But really, why the FDA first insisted on this is that they had these newer testosterone products do what's called ambulatory blood pressure monitoring. So these people had devices that they wore over like 24 hours, and blood pressure goes up and down. Mm-hmm. The bottom line was, and this was the basis for the original black box warning, the amount that the blood pressure went up with systolic blood pressure, which is there are 2 numbers, right? There's a higher number, a lower number. Mm-hmm. Systolic is the higher one. It went up by only 1.8 millimeters of mercury. So if a normal blood pressure is, let's say, 120 over 80 used to be the old number, if people want to change it, but let's say 120 over 80, it would be the equivalent of 121.8.
Oh my goodness.
If anybody has ever had their blood pressure taken, that thing can vary over the course of the day by 10 to 20 points easily.
For sure. And even in that moment, the margin of error.
Even the moment, you can repeat it twice.
Yeah.
Right?
Right.
And it can be off by 10 easily. So, and it's an average, which means, as it turned out, and the data was that for some people it went up, for some people blood pressure went down.
Oh my goodness.
But on average, it was an increase, and it was an increase of a trivial amount, in my opinion. So, but the FDA is an interesting organization. Let me ask you, when you hear FDA, mm-hmm. What pops into your mind? What do you think? What does the FDA represent to you?
The ultimate authority on drugs in this country.
Right. So that's pretty good. I like that comment. But so you're right. So the FDA came into being to protect public health. And it's been around for a long time, I believe back to the 1930s, but the thalidomide scandal, which happened in the 1950s, where there was a drug that was supposed to help with morning sickness, amongst other things, for pregnant women, turned out to create these terrible limb deformities in the babies when they were born. And the FDA was given then additional powers through Congress to basically regulate the pharmaceutical industry. Technical name of the FDA is the Food and Drug Administration. It also governs, by the way, cosmetics and food, but we think of it mainly, certainly in medicine, as the pharmaceutical industry. So it decides if drugs are approved or not when there's a new drug. It decides what to put in those labels we're talking about, and can put restrictions on it. What's interesting is how it's gotten into the medical community. So, once there's a drug that's approved, physicians can use a drug. Let's say it's approved for, take Cialis. Cialis is approved for help with erections and actually help with urination. But there's data that shows that Cialis is also helpful for endothelial health, like for the lining of the blood vessels.
And I think it's helpful for marriages too.
It could be helpful for marriages, although that's not one of the indications from the FDA for Cialis. And so doctors might use that drug in somebody they think could benefit from help with their endothelial health. As one example, we have drugs for erectile dysfunction when pills like Cialis and Viagra don't work. People often do these injections. We've talked about it on our podcast before. That includes an injection in the penis. And the most typical thing we use is a combination of 3 meds. It's called Trimix. And 2 of those drugs have no indication for use for erectile dysfunction. But it was discovered that they worked in the 1980s, and so we use it. So that's considered off-label prescribing. And every field, there's specialists who use drugs in ways that the FDA didn't approve them, but they're available and doctors can use them. The weird thing is that because the FDA has a lot of expertise, and because of the role it's played within medicine, a lot of doctors kind of bow down to whatever it is that the FDA says. But every specialist in every field knows that the FDA gets some things wrong.
Right.
And in the testosterone world, the FDA has been a hurdle more than a help, I would say. So I have tremendous respect for the organization and the work that they do. Public health needs to be protected. But when we talk about testosterone, for example, FDA, as of 2015, says that the vast majority of men who now are considered candidates for testosterone, where we don't really know why their testosterone declined, FDA says that is age-related and you should not treat those men. Well, it's just simple nonsense. FDA has a warning about prostate cancer that you shouldn't give testosterone in men not only who have a history of prostate cancer, but even if there's a suspicion of prostate cancer. And the irony is that if you're over the age of 50,
we're suspecting.
I'm suspecting
it's not funny, but
prostate cancer.
It's true.
One out of 6 men in their lifetime gets prostate cancer.
Right.
So, and the data around prostate cancer are at this point superb. Testosterone does not increase the risk of prostate cancer. And of course, my career, I've been treating men with a history of prostate cancer with testosterone, for a very, very long time. There's no evidence that it increases the risk. So, I just want to say, I just wanted to bring this about. Those of you who are listening or interested in testosterone, this is a good thing. I give credit to the FDA for actually paying attention to the science when they were confronted with it, taking in the new information and revising their guidance around that. So kudos to the FDA. Kudos to the pharmaceutical company that negotiated with them to do this. It'll apply not only to their own product, but to other testosterone products that used to have the black box warning. And the impact on physicians, if you're an expert, people who are specialists tend to not look at the product labels to make their determination of what's right. They look at the science and the evidence.
Yeah.
FDA has a much lower threshold for saying something might be risky than actually having double-blind studies and things like that. So there's some stuff in there that they put in that may or may not be accurate or proven. But congratulations also to the testosterone manufacturers that called out the FDA in light of the new data. And maybe one day we'll see changes that relate to prostate cancer too, where they'll be taken out of the label completely. And this age-related nonsense hopefully will disappear one day too, but that's a bigger battle.
And, the ladies here, we need a product for us, if I may put in a little plug.
Yeah, well, yeah, exactly. So there are no testosterone products for ladies. Ladies, I sound like I'm in some old bar lounge. Ladies. But yeah, there are none for women. And yet testosterone is really good for women.
Right. So we have a problem here that maybe it should be addressed in other podcasts, but...
Yeah, exactly right. One testosterone product in the world approved for women that's in Australia. It's a patch. There have been a couple of applications for new drugs in the United States for testosterone. None recently, all rejected by the FDA for one reason or another. FDA is a little funny about hormone treatments in general, I think, for men and women. And yet the FDA does, despite the FDA's antagonism, and I use that word advisedly, antagonism towards testosterone, it does seem to approve drugs. We have more than 20 drugs available for men. And for women, nada, zero. That's a good topic for another day too.
Yes, it is.
Great. Well, Dr. Brandon, it's a pleasure talking with you as always. And I hope to see you for another podcast.
You know what? You will. I guarantee it.
Can't wait.
Yeah.
All right. Bye-bye for now.